Hello everyone, my name is Jason Hall and this is my video. Just to tell you a little bit about myself, I'm a professor of radiologic technology at Monroe Community College, and we teach our students in two different ways. Half of our curriculum is taught in the hospital on real patients and the other is taught on campus. So my project, what I'm hoping to accomplish is to integrate um, devices to have the students interact on a virtual reality type program that they can interact with patients, virtual patients, and test ideas and back up what they learned inside the classroom. So some of the devices that they could use to access this online program would be smartphones, laptops, iPads. They could use their smartphone, that they have on them all the time to access this. The reason why I think it's important is we really do throw a lot at them all at once. Inside of our curriculum, it's just very fast paced and students really are overwhelmed sometimes. So really just to back up what we teach them in the classroom, it would be nice if they went ahead and um, learned on their own at home with this virtual environment. Our hospital rotations are kind of limited. It's based on when patients are actually coming into the hospital. So there are some times where 2 hours might go by and they don't actually get their hands on a patient to work on them and actually, do an examination to complete that. So my suggested environment is a virtual X-ray room that they can access with our devices that they have. Um, let's see here. So students of radiology may practice without the fear of making mistakes on real patients, and they may practice at home supplementing classroom lecture anywhere. So if you guys take a look at the screen here, I did find some video on how hospitals already are using this type of technology for nurses, doctors, to actually simulate procedures online. So I'm going to press play here, and you can take a look at this particular person inside of the virtual hospital environment, trying to find their way to the correct department. Yes, there's a library there. Right now they're taking a look at signs to see if they can find the correct room to go to. Now this particular program is not for X-ray, but I believe it's a surgical one. So I believe this person is trying to find their way to a surgery suite to actually participate in a virtual surgery. Sounds like you found a bathroom. That's important. So that's just an option that they do have. The environment, I guess, is perfect for what we needed. Hospitals are usually pretty sterile looking like this with a lot of white. So let me pause this here. And what I actually did find on this next site here is an actual virtual radiography program that they have out there, which I found very interesting. So if you take a look at the video on this one, so they're showing here a lateral ankle using the X-ray tube and the images that come up. What I find interesting about this one is that you can actually manipulate the post-process image to see how you can change it using window and level before you send it to the radiologist. It also looks like they have resources to manipulate the image in a 3D so the student can see what they're doing if they did make a mistake, how to correct it, which I find very, very valuable. So really my goal is to supplement their classroom activities and really just give them a step up on practicing. We really get limited time to have them just generally practice in an open session once we've taught them body parts. We usually teach them throughout our program about 300 examinations from start to finish. And from those 300 examinations, we teach them probably 6 to 7 projections per examination. So as you can see, that adds up to a lot of procedures that we teach them over the years. So my goal is for them to go home to practice. Most of my students are from the ages of 18 to 45, and I don't think I haven't seen one of them not holding one of these devices since I've known them. So it's definitely a device they would have on them. Some of the students, are constantly playing games on their phone, and using this type of software can actually make learning fun while they can practice at home, supplementing what they learn in the classroom. So thanks for watching my video, and yeah, I'll talk to you guys soon. Thank you.